Okay. All right, I'd like to introduce our guest speakers. Nancy Cavanaugh is a pediatric nurse practitioner and child health advocate for over 40 years. She has been a NAPNAP member since graduating from the University of Virginia's PNP program. She served as chair of the NAPNAP Health Policy Committee and is a past NAPNAP Executive Board member at large. Working in school-based healthcare, her passions include immigration issues and caring for vulnerable youth and adolescents, as well as the impacts of climate on health. Nancy is currently enrolled in an MSN ED program and is a brand new grandma to a 3-pound, 9-ounce baby girl named Lucy, born just a few days ago on August 28th, which has made her 2020 an exceptional year for that and for her family. And so it's always good to have good news in 2020, right?
Agreed.
So thank you, Nancy, for joining us. We also have Dr. Kathy Lux, and she has been a nurse practitioner in clinical practice since 1994. Currently, she is the lead APP for the community-oriented primary care clinics in the Dallas area, where she oversees, or excuse me, where she has overseen doubling of the advanced practice provider service. In addition to her clinical work, Kathy has been active in advocacy for many years. She's a past NAPNAP advocacy scholar and visits Washington, DC annually to advocate for child health and advanced practice nursing issues. At the state level, she regularly attends Texas Nurse Practitioner Capitol Hill Day in Austin and is TMP Legislative Ambassador. A passionate supporter of APRNs in leadership, she's also pursuing an MBA at UT Dallas. So thank you to our special guest speakers this evening. Nancy's going to go through some ideas and recommendations at the federal level. Then Kathy is going to share her experiences for the state level. And then we'll be able to ask both of our guests questions when they wrap up.
So I think my story is compelling to share with you my experience with Greg Walden, who is our congressional representative from Oregon. When I first got involved with politics was ages and ages ago, but so when we moved to Oregon, I connected with Greg. I mostly connected with him over veterans issues because my husband's a veteran, my son is a veteran, but also because I worked in a federally qualified health center and I was really interested in his support with that. As I became health policy chair, it was important for me to develop an even closer relationship with Greg because Greg was chair of the Energy and Commerce Committee, which oversees Medicare and Medicaid. And it's a pretty powerful committee, and especially as the chair of the committee, he was a key person. I have to say at this point, I am really grateful to Dave Mason because while I had a relationship with Greg and had met him several times and even met him for coffee in town, and you know, we knew each other on first name basis. We are of a different political persuasion, and he's more conservative than I am. So I had some concerns about reaching out across that aisle, even though Greg had really a good reputation for reaching across the aisle and building bipartisan support for things. So like I said, I really credit Dave Mason for kind of moving me through that process and finding ways to build those connections and to not let differences get in the way. I think one of the things that's really important is that no matter how inadequate we might feel as pediatric nurse practitioners in the realm of politics, we are the pediatric experts and we know way more than any congressional leader can possibly know about pediatric health care. So our opinion is important on multiple levels. We're a constituent, and so our voice matters. But also we have compelling stories to tell, and they need to hear those stories, and they need to be able to relate to what's really happening at the clinical level. So I worked with Greg on CHIP, which is a child health insurance policy program. I worked with Greg on federal qualified health centers. I would send his office information because he's interested in veterans affairs. We happen to have quite a few articles come out on military families um, and healthcare related issues with military families. Whenever anything like that came up, because I knew he was interested, I would always send that journal article to him and his staff. We talked many times about immunizations. We talked a lot about immigration, and especially stories that I had related to working with children from Hispanic families as the political debate on public charge became a lot more contentious. Um, I think one of the things that I wanted to say was that it's not to be afraid to meet with staffers, and the staffers become your best friends, and literally you can text and email and connect on a very intimate level many times. Sometimes the staff would, lots of times I would reach out to them, but sometimes the staff would reach out to me. A good example of that was in February. I was actually with my grandchildren in California before COVID, before we knew of COVID, and I got a call from Greg Staffer asking me that they were wanting to set up a meeting in Medford, Oregon, which is the town next to where I live, um, about the COVID news and to try and get up to speed with people on what's happening, what they know, and ask. And their call to me was, their ask for me is, can you please tell us who are the key people that we need to invite to this meeting? Like, you know, as you're thinking about this, as you're reading it in the news, who are you concerned about and who do you think should be there? And I think that speaks to that developing that relationship, that they could move from my always sending them information to being contacted and asking for information. That wasn't the first time I had an ask from them. And a different kind of an ask was, and remember, I'm a Democrat, Greg's a Republican, but a different kind of ask was when he was running for reelection, he wanted to do a commercial with a nurse practitioner or somebody, you know, a physician or nurse practitioner working in a clinic with a child, to talk about his work with CHIP and federally qualified health centers, and asked if I would be willing to do that. And I was, and I had great support from my the federally qualified health center where I worked, which cleared out a room, took away any identifying, because of, you know, you don't want to make it look like you're being political. But anyways, took away all the identifying information. We did a filming, makeup, the whole thing. It was kind of fun. You know, it was really short, just, you know, 30 seconds or so. But that was a, you know, I felt like a great way for me to repay him for all of the connections and resources and support that he was, because really CHIP was a huge success, and very grateful for his work in helping to make that happen. So it showed to me that, you know, going across the aisles can go both ways. It's not just for that we want our congressional leaders to be able to do that, but we also need to be able to do that and not be afraid to reach across the aisles. Anyways, I think that kind of summarizes my relationship with him, and I'm going to turn the time over to Kathy at this point, and then I'm open for questions anytime.
Okay, so I'm Kathy Lux, and I am charged with talking about state leadership in advocacy, especially related to child health and advanced practice nursing. And the title is How to Connect for Maximum Impact. Kind of makes me sound like an asteroid, but other than that, the basic premise is that all politics are really local. That dates back to the 1930s, but it's still true today. Federal government determines a lot of how the funding works, and but really the practice acts happen at state level, and the budgeting and all the money things follow, are at the state level. So honestly, how you practice on a daily basis, how you can delegate, and how much money goes to the programs that you maybe refer to quite often is at the state level. So you really have to be involved at the state level. And most people actually start at the state level rather than the federal. One of the biggest things to understand is the difference between Medicare and Medicaid. Medicare is a federal program. For example, the MACRA Act of 2015 allowed DME signatures for Medicare, but not Medicaid, for example. And then the CARES Act this year allowed home health signatures for nurse practitioners for Medicare. However, Medicaid is run by the state. So if you don't have a good relationship with your state, and you don't have a way to advocate for things like signatures at the state level, then it really, really impacts your practice. So, so it's really important to understand what's going on in your local environment. Honestly, that's a matter of just studying and getting to know what the climate is like, both with your representatives, your local representatives, and also at the state level. And I come from Texas. Texas is huge. It is a place that believes that government is best, which governs least. Our state's constitution was written right after the Civil War, when the government was very much against interfering. They wanted minimal government and minimal power of government. So our legislature only meets 140 days every 2 years. So our legislators are part-time, very part-time. They get paid $7,500 or something. Not enough to live on, for sure. So they have full-time jobs in their home, their home district. So that makes lobbying and influence very strong. So it's a very strong and powerful thing. And the legislature is often called the place where bills go to die. So about 95 to 99% of them never make it past introduction. And that's on purpose, because that's what the Texas founders, they wanted it to be hard to pass new legislation and kind of let people be what they want to be. So when I was thinking about what to do at the state level, I thought about what got me involved, what got me interested. And I think it's basically, it was 3 separate pieces that kind of go together in kind of a Venn diagram. But the first thing was finding mentors and role models. When I took my BNP, the person who instructed me was someone who'd been friends with me for more than 20 years, Sherilyn DeHigo. She persuaded me to apply to the NetNap advocacy scholars, and that took me to DC, and I met a lot of change agents, and it got me really fired up. Also, Kristin Hittle Gigli, and she was our representative in the Greater Texas NetNap organization. Advocacy was just like breathing to her, and she had such deep knowledge. So, she was an amazing person to kind of follow on that role. And also someone else, Linda Wolbert, who was one of the founders of the coalitions that brought all the nurse practitioners and other APRNs together in Texas. Texas is a huge state. There are 4 NetNap chapters just in Texas, and possibly a 5th that may be forming the Panhandle. So it's huge, and trying to coordinate anything together in Texas is really, really challenging. So it's really, really important to coordinate with people and meet people. So when I became the NetNap advocacy scholar and went to AANP, I met a lot of other people, not just ED people, but adult family, dairy people, women's health, all those other different groups. And I kind of got to see a larger world than just Texas. We're very insulated in Texas, and we have delegated authority. We are one of the 12 states that still is in the red. So meeting people who actually owned, who didn't have to get delegation, who didn't have to do all those things, was incredibly inspiring and very educational. So I learned a lot of things at the federal level, and I started to really, really understand what was federal and what was state. Because because you really don't want to go to a state legislator and talk about federal things and vice versa. So deep understanding is really, really important. And again, we're all nurse practitioners. We know how to talk to people and educate people. We know how to learn what we need to know in order to talk to our patients and instruct them on what to do and their families. So it's not a big difference to talk to a legislator. You just have to educate yourself and become confident. And also remember that you are representing your profession. You're not there as, you're there in a professional role, and you're representing nurse practitioners. So personal politics, just like Nancy was saying, Texas is very Republican. It is bright red. Dallas is kind of purple, but you go in there and you bring in the issues that are pertinent to nurse practitioners. And quite often you will see a reach across the aisle. A lot of people, Tea Party, we have a lot of Tea Party people, they are very, very open to decreasing regulations and opening up choice for people. I'm not a Tea Party person. I'm a Democrat like Nancy, but there are really ways to build bridges if you go in with an open mind and understand they're just people too, and just like patients who may not agree, you may not have you may not have the same belief system. You have a common goal. In patients, it's to get them better. In with nurse practitioners, it's to deliver health care in the best and most efficient way. So I guess so I talked about mentors and role models and lighting the fire, the conferences giving you some of that information and learning and networking and understanding. And I think the third piece, the professional organization. NAPNAP was where I really started to learn advocacy. I really got at a local level and at a federal level, I learned a lot. And I think the most important thing is being able to, at a state level, try to coordinate with the other groups. And since NAPNAP, we have just 4 chapters of NAPNAP alone. I think there's over 10,000 nurse practitioners in Texas or something. Correct me if I'm wrong, but it's a lot of nurse practitioners. So we've had a couple different organizations I'd say about 25, 30 years ago, people like Linda Wilbert brought together into an organization called CNAP. And CNAP brought together nurse practitioners, nurse anesthetists, nurse midwives, and clinical nurse specialists. So they all coordinated together and had meetings, regular meetings in Austin, and then went and talked to their legislators. So that's, so they developed an agenda, they developed a legislative priorities list, and then basically what they did, they had a unified front. And now it's gotten a little more splintered now that TNP is kind of its own thing, and the nurse anesthetists are their own thing. They formed something called the APRN Alliance. So they still have a commonality of message. The key is the ask, you have less than 5 minutes to do the ask. So you want to be clear, concise, and have as much uniformity as possible, so that you don't confuse the legislators, because they are not experts. Very few. We don't have any nurse practitioners in Texas in the legislature. We have a couple nurses and we have several doctors. So everybody else basically have to start at a very basic level. But with that, you have to make it personal as well. I bring in stories about my patients. I bring in stories where I can't deliver care. I can write a prescription for an albuterol inhaler, but I've had pushback from pharmacies because I can't get the inhaler, the tube, the little spacer, because that's considered DME by some pharmacists for some reason. So and those are the kind of stories. And then if you have a personal story that talks about a patient or about your own personal experience, it really brings it home to that legislator. And I've had a lot of success developing relationships with legislators, and you just talk to them like they're people, like they're your patients. And whether they're Republican or Democrat, you go in with an open mind and listen, because they came to their place in life for a reason. Their belief system is important to take in mind, but you're representing nurse practitioners. So I guess the biggest thing right now, we have 2 Democrats for the representative and the senator here. And I've been to some of their fundraisers. I follow them on Facebook. I have their office email, their kind of their private ones. And you just show up to things and you meet them. My representative, his kids went to the school that I used to be PTA president of when my kids were little. They love robotics. Their kids love robotics. We coach a robotics team. So you find commonalities, you invite them, you just make yourself open. You go to their open houses. So that's my big piece of advice is finding mentors, learning about the background, and trying to coordinate with your local organization. So and that gives you the confidence. And if you ever have any doubt, I think your local organization will probably give you somebody to go with you to your first meeting. I've never said no to anybody who asked. So, and I think most people who do this are crazy. They're policy wonks and they love what they do. It's really exciting to be in a room full of health policy people because they are change agents and they're very passionate about this. So that's kind of my spiel. Anybody has questions?
Excellent. Thank you so much, Nancy and Kathy. Fantastic information. So do we have any questions? You can unmute yourself.
Hi, it's Sarah. I was going to ask in terms of like, what was some of the ways that you first, met some of, like not met, but how did you really get the mentorship? Because a lot of people, you talk to somebody once and then they may give you a few ideas, but how did you really build that relationship with the mentors that were your nurse practitioner colleagues in order to kind of get you started and on the right track?
Well, Sherilyn was a friend for many years, and she helped run the DNP program at UT Arlington. Taught me into going into the DNP program. So we were already friends through NAPNAP. Some of my longest and best professional friends are NAPNAP people, because I started in NAPNAP when I was a student, and have kept that commitment all along. NAPNAP is so important for pediatric. AANP and TNP have overall goals, but we need to focus on the PD things. So I went to the meetings, I got on the board, and then I was past president of Greater Texas NAPNAP, and I'm on the board still as health policy chair. I ran their website for a while, a bunch of different things, and then I got involved in North Texas Nurse Practitioners. I've been on the TMP board, and I'm currently North Texas Nurse Practitioner president, and having just synergy. It's just meeting people, going to things, and talking to people. And you kind of tend to find the health policy people at the health policy meeting. So just developing those relationships.
Kathy, you mentioned the Advocacy Scholars Program too, and I think that's another key way of getting involved and finding who those players are, the people who really love policy and like to get involved. It can be a little bit scary to start, but it's just like anything else that you haven't done before. There's a learning curve, and once you've done it a few times, you realize they're just men and women just like us, and they really do depend and need our expertise. So there's nothing to be really afraid of, and it's over quickly. If you get 15 minutes, that's fantastic. Lots of times it's a rush, but you have to work at the relationship too. So, get the cell phone number of the staffer, get their email, exchange cards, and then follow up, send them something. It doesn't really matter. I would really every time a journal article came out that was relevant, I would forward it and just say, I saw this, thought of you. Let me know if you have any questions. I'm still here, happy to help. If I had something that I wanted to talk about, I would put in a request. I would love to talk to you about what we're experiencing here in Medford and Central Point related to public charge. If you have 15 minutes that you can give me, I would love to talk with you. So you don't have to be the expert. You just need to care. And if you have a story, then share your story.
Excellent. Thank you, Nancy. Thank you, Kathy. Other questions for our speakers?
Hey, it's Kristin. Thanks for a great presentation. Hi, I'm waving. You don't want me to turn the camera on, so I'm just going to virtually wave. I wanted to know if you can think of a time where you look back and you're like, oh, I really wish I hadn't done that. What lesson learned would you share with us?
I do remember when the election was happening, because I had such a good relationship with Greg Walden. So when this past presidential election was in process and Trump had just got the nomination, I remember saying something to Greg about, I can't believe the Republicans have Trump in office, and what were they thinking? In looking back, I remember thinking, I regret that comment. But we're human beings. It's okay to voice your opinion.
I agree. You have to be super, super careful in Texas, and there's a lot of partisan politics in Texas. So you have to tread very, very lightly. I think my biggest thing was when I started going as a student, DMP student. I'd already been a nurse practitioner for 20 years, so I was basically kind of intimidated, and I always kind of assumed someone else was going to do this. Somebody else knew more than I did and could do it, and I started realizing when we were talking to the people, they had lots of questions, and most of the people I was with were students becoming nurse practitioners. So I had 20 years of experience. I could talk about things that had happened, and I'd seen how the nurse practitioner profession had grown, but I never attributed that I needed to do anything for it. So I regret not being so reluctant, being hesitant, being scared, and not, trying to kind of get educated about it earlier. I mean, you don't have to necessarily do a whole lot, but just understanding it. What took me so long to realize that was important.
Thank you. Do we have other questions?
I just wanted to say thank you. This is Raji, the immediate past president of NAPNAP. Thank you, Nancy and Kathy, for your comments. And you're always an inspiration to me in all of this work. And I just wanted to make two brief comments. The first is I can't underscore, of course, enough the power that NAPNAP has in this space. And I feel like I've gotten to learn that being a member and serving on the board. And I too was an advocacy scholar. And I think that that was my first entry point into all this work. And it definitely gave me the spark to be more involved and more engaged in advocacy work. So NAPNAP just has so many wonderful opportunities. And as we'll hear from Dave, I know shortly, there's so much that we're working through, and people come to us for our opinion, our understanding of child health issues, and they want to hear from us. And so I'm just really proud of that. And I think to both of your points, that when I've met with local legislators, or when we all got together in Washington, D.C. last year and had the opportunity to visit different legislators on the Hill, I'm always impressed when I start meeting and talking with these folks. I always try to sort of say, well, have you talked with a pediatric focused APRN before? Have you worked with a nurse practitioner before? And if anything, we go in wanting to talk about whatever the child health issue is that we're so passionate about. But if you leave with them just having a better understanding of us and who we are and what we represent and what we do, that's a huge win. And I think then continuing that dialogue to both of what Kathy and Nancy have said is so powerful to it, of circling back and saying, oh, right, that Raji, that NP came to talk to me about that. That's something that this might be interesting to that person to do. So I think that that's always a wonderful opportunity. And like anything, it's just jumping in and doing it and learning from the process. And the more you do, the more you feel comfortable with. And I think NAPNAP's just been a wonderful place to support all of us to do the work. So thank you again, both of you, for your comments tonight.
Thank you. This is Michelle with the National Office, and I will share a couple of tidbits that I've learned in my 8+ years here at NAPNAP. Again, NAPNAP, as Raji said, is definitely the place to learn all these things, and it's so nice seeing so many advocacy scholars on the call and remembering when it was your year and whatnot. So Mary Chesney, who I attribute to being like the godmother of health policy at NAPNAP, and Ann Sheehan before her and Karen Duderstadt, but we learned lessons from them. They were just amazing MPs. And Mary has said that getting full practice authority in Minnesota was an uphill battle. It was not quick. It was many years in the making. And so I know that can be frustrating to have to walk away from a bill if it's not really what you want. And especially if there's certain APRN groups in the state that really want something, you might get pulled in even if you don't believe in it. So I think, Mary's message of stand your ground, do what you really think is right. Don't necessarily feel like you have to make the compromise. It's better to walk away and come back the next year swinging. And, and again, it will take years. So, lesson from Mary there. And also a very similar lesson from Lacey Eden and Beth Luthi, members in Utah who worked tirelessly for several state legislative sessions to get a bill passed regarding immunizations. I guess Utah used to be very lenient on opting out. And so Lacey and Beth are passionate about immunization, and they worked with a state legislator. They built a reputation with the legislator and helped write a bill that basically mandated that parents had to take sort of a little educational course. I think it might have been online or maybe it was in the office of, not very long, but just understanding what are immunizations and what it means when your child does not get one and what it means to society. And they worked very hard on it, and they were crushed a couple times when the bill didn't pass quickly and it had to come back in another session a year or two later. So again, just it takes a while to get some of these really important bills passed. So stay the course is definitely another lesson. And I want to ask a question of Kathy. So Kathy lives in Texas, where the infamous Andrew Wakefield lives, and he stirs the pot of the anti-vaxxers. And Kathy told me last, 6 months, 12 months ago, that anti-vaxxers were gaining steam at the state legislative level. And so Kathy, you mentioned earlier, and you and Nancy both said, you're being the experts. And so how do you go into Texas state legislature and say, I'm a healthcare expert, I know the science, and sort of give the people who do believe in vaccines the ammunition to fight their colleagues who are these anti-vaxxers at the legislative level?
Well, that's an interesting thing. And I think that's one of the things that's so important with NAPNAP, because I remember when I went to the national convention and Utah was talking about it, their larger nurse practitioner organization was afraid or hesitant to support them in the vaccine bill because they were afraid of the negative blowback. And we've had actually legislators doxxed and harassed and personally threatened who supported pretty weak vaccine, like just being able to find out what percentage of kids in your kid's school are vaccinated, like that level of legislative surveillance, and that's not even a mandate, that's just finding out stuff. And he had to shut down his Facebook page. This is Jason Villalba, and he's a Republican, but Republicans and Democrats who are mainstream, who are like centrists, generally support vaccines, but TNP probably wouldn't take that up, and that needs to. So I would say that I would come in armed with information. Having been a PICU nurse for 7 years, I saw kids die of those diseases. Between 1987 and 1992, I worked at Johns Hopkins PICU, Children's PICU, and then did some health nursing. And I saw kids die of those diseases. So I could talk about seeing a child die of epiglottitis, an 18-month-old who'd been healthy just days before. And being able to testify to the devastation that those diseases actually did cause, because a lot of the legislators are younger than me and maybe have never seen measles or have never seen even chickenpox. So I can go in and say, look, from my experience, these are terrible diseases, and I've seen kids suffer and die from them. So there's that personal experience, because it really sticks. You can get all the graphs, all the percentages in the world, but Wakefield is successful, and the anti-vaxxers are successful because they're not tied to science or the facts. They can give you the story, the exception, the personal history. So what we need to do is make our facts come to life and talk about people that we know that were affected, that were impacted, and make it real. The previous state senator that was our representative was my local representative was he was a Tea Party guy, Huff Hines, and very, very welcoming, very nice guy. I met with him probably a dozen times, but he only only got his kids vaccinated because they were traveling out of the country. He said he wouldn't have gotten them vaccinated otherwise. And we had some really good conversations about why vaccines are important. So you kind of come at them as like a human being and say, you know, it can talk from your experiences. So that worked for me.
Thanks, Kathy. Any other questions for Nancy and Kathy? Well, if you have questions, you can always email healthpolicy@napnap.org, and we'll forward the questions along and get answers from Nancy and Kathy for you. So I'd like to now turn it over to Dave Mason, our Federal Government Affairs representative. So Dave, tell us all the greatest from DC, please.
Thanks very much, Michelle. And I can't help but follow up on the presentation that Nancy and Kathy just gave. First of all, they are such incredible examples of what nurse practitioners can accomplish in advocacy efforts. And I'm struck by the idea that we've got 21 folks on this feed this evening, and we need to get the message out to so much a larger crowd that this is such an important priority and so achievable if folks are willing to put in the effort to do it. I think Nancy and Kathy have both talked about both the challenges and the opportunities, but the advocacy importance of it is just really critical, particularly at the state level where so many of these policies are really decided in terms of limitations or opportunities for advanced practice nurses. But having said that, and I'm sure I'll say more about it, talking about what's going on at the federal level, you all probably are well aware that Congress is currently in a recess until next Tuesday, when members will come back to Washington to continue their legislative work up until the election, November 3rd. With time off for religious observances, they'll really have about 23 legislative days before they have to leave for focusing on the campaign, and only about 10 legislative days until the current fiscal year ends at the end of the month on September 30th. That means really that only pieces of major legislation on the calendar will move forward. And that's likely to include the 5th coronavirus relief package and a stopgap measure to extend government funding for federal agencies and avoid a government shutdown in October, as well as potentially reauthorizing the defense authorization programs. As you no doubt know from all of the news reports on the coronavirus situation, negotiations between the Trump administration and congressional Democrats have really stalled over the last few weeks, with some concessions by both sides, but still falling short of jumpstarting the negotiations overall. Earlier today, Senate Majority Leader Mitch McConnell said he's not optimistic about the chances of Congress passing another coronavirus stimulus measure at all. And at the same time, the Congressional Budget Office earlier today projected that the federal budget deficit will rise to more than $3 trillion this fiscal year. That's larger than the size of the economy as the result of the previous already enacted stimulus for coronavirus, and will add about $13 trillion to the debt over the next decade. That adds a lot to the debate that we're going through currently over what the size of this next package will look like. Treasury Secretary Steve Mnuchin told a House committee yesterday that parts of the economy urgently need additional fiscal stimulus to rebound from the current virus situation. However, after meeting with the committee, Mnuchin talked to House Speaker Nancy Pelosi to try to revive the talks. And in that discussion, Pelosi basically said their conversation made it clear that Democrats in the White House continue to have serious differences. So at this point, the most serious and significant dispute seems to be over the size of the overall package. The White House and the Senate Republicans want to limit the cost of the new package to about $1 trillion, while Democrats have continued to push back for something along the lines of the nearly $3.5 trillion HEROES Act that was passed back in May. Democrats have offered to come down to $2.2 trillion. Republicans have offered to come up to $1.3 trillion, but we haven't really gotten any closer than that. The Senate Republican leaders said yesterday that they want to vote next week on a bill that they call a focused or targeted relief bill that would cost about $500 billion, so a much smaller package, setting up what they hope would be a politically difficult vote for Democrats before the election. And they tried a similar effort back in July that was scrapped after they were unable to agree, even within their own party, about what would be included in the proposal. Any plan like that would require 60 votes to move forward, so Democrats would easily be able to block it. And it would simply be a starting point for new negotiations. What they have been talking about this at this point, and what seems to be part of the next bill at this point, is a reduced weekly boost in federal unemployment benefits to about $300 a week throughout the end of the year, as well as liability protections, another round of payments for the Paycheck Protection Program, and about $105 billion for education. But all of those talks so far have left out additional funding for state and local governments, including Medicaid coverage, or delaying cuts in the enhanced funding for the Children's Health Insurance Program, issues that NAPNAP and other groups have been pushing for. As you probably know, and I hope you know, NAPNAP issued a call to action last Friday for members to urge their members of Congress to not forget children's health care priorities in the next relief bill. That call focused generally on access to care, including vaccines and preventive services, increasing funding for state Medicaid programs, delaying a reduction in the Children's Health Insurance Program, and ensuring that states maintain and expand eligibility for enrollment programs. It also called for increased funding for nursing and public health workforce programs and for expanding vaccine programs in the next bill. Not clear whether any of those priorities will clearly move forward, but they all are truly priorities for the next package. And NAPNAP has also been working with Representative Lauren Underwood from Illinois on legislation that she's introduced, the Community Immunity for COVID-19 Act, which is HR 8061. That would authorize $560 million for state and local health departments to promote vaccinations during the public health emergency, not only coronavirus vaccinations, but also the regular vaccinations that should be taking point at this part of the year. White House Chief of Staff Mark Meadows also last week said that he does not expect to reach an agreement with the Democrats until the end of this month, and foresees a coronavirus relief package being attached to a must-pass bill that would extend government funding for federal programs beyond September 30th. And speaking of that, the funding for federal programs will expire on September 30th, unless the Congress passes a stopgap measure. The House has already passed 10 of the 12 independent appropriations bills for fiscal 2021. But the Senate so far has yet to propose any or pass any of those 2021 spending bills, largely because the senators haven't been able to agree on how to handle the emergency spending for coronavirus response. So as a result, right now, Congress has really little choice but to address that short-term spending bill. That would probably, no details are available yet, that will probably extend funding into a post-election lame duck session. And then the decision will be in the lame duck session whether to actually reach an agreement on year-end spending or kick the spending decisions into a new Congress and potentially a new administration. I should probably go back over the details that for nursing and research programs, what we know so far is that the House has passed in July its version of the labor HHS bill that would include $10 million as an increase for the Title VIII nursing workforce programs up to a total of $269 million. That includes a $3 million increase for the advanced education nursing program. And it also includes a $5 million fund for a nurse practitioner optional fellowship program to establish or expand optional community-based nurse practitioner fellowship programs for practicing postgraduate nurse practitioners in either primary or behavioral health programs. And there's also funding for the National Institute of Nursing Research in there, about a $1.45 million increase. So as those negotiations go forward, nursing groups are also trying to encourage legislators to include provisions of a new bill, which is called the Future of Advancement of Academic Nursing, or FAN Act, S4398 or HR 7945, which would create a $1 billion nursing education enhancement and modernization grant program under the Title VIII programs in the Public Health Service Act to increase the number of students and faculty in schools of nursing as they currently stand. Not clear that that will move forward. The bill has been introduced and there is an effort to move that forward. In addition to all of those things, of course, there have been a lot of developments, generally speaking, with policies related to the coronavirus. I should mention probably that earlier today, the Centers for Disease Control and Prevention told states last week that they should prepare for coronavirus vaccine to be ready for November 1st and asked them to remove obstacles that would prevent distribution sites from opening. That notification has raised some concerns that the administration is already dismissing, that the authorization might be rushed ahead for political reasons. The administration has also agreed to purchase 150 million rapid response kits that would be granted emergency authorization by the Food and Drug Administration and hopefully can produce results within 15 minutes without the use of lab equipment. Those things are yet to be resolved, but moving forward. And there is still a controversy over changes in the CDC testing guidelines to exclude people who haven't shown symptoms of COVID-19, even though they have been recently exposed to the virus. So current controversy is still extending around that issue. And then there is also new evidence and new controversy over the efficacy of convalescent blood plasma treatments authorized by the FDA last week. New evidence just out today that questions whether those treatments are really efficacious. So a number of issues on all of those things going forward. And I think the safest thing to say is that when Congress gets back in session next week, there will still be a ton of issues for them to resolve and a lot of opportunities for nurse practitioners to weigh in on the priorities they're most concerned about. And I think with that, I'll stop and see if you have any questions.
Thank you, Dave. That was really great and very informative for all of us. So do we have any questions for Dave? Don't forget to unmute yourself. And while you're doing that, I will just let folks know that plan to join us on Wednesday, September 23rd, just a few weeks from now, when we will be having our next Team Peds Town Hall. And that Town Hall is going to feature NAPNAP member Patsy Stinchfield. And so some of you know Patsy is an infectious disease expert. She ran the measles outbreak in the Somali community in Minneapolis a few years ago as in her role at Children's Minnesota. She's also the president-elect of the National Foundation of Infectious Disease, the first nurse practitioner to hold that role. And so we're really excited. She's going to be talking about some of the issues that Dave has mentioned, including, the plan to distribute these and fairly distribute and allocate the immunizations. There's definitely a discrepancy between the clinical trial ages and those who are perceived as needing it the most first. So please plan to join us on Wednesday, the 23rd. Do we have any questions for Dave?
Hi, this is Kathy. Can you talk a little bit more about the fellowship program you were talking about for psych and you said primary care that they're proposing?
Sure, I can't talk a whole lot more about the details of the program itself because that will come through regulations that I don't think have been out yet. But there is still in the appropriations bills the opportunity to create some funding for that grant program. So I anticipate it's still up in the air what the Senate will be able to include in their package, whether they will go along with that particular funding. If they do, there will be an opportunity at some point down the road to review the specifics of how those grants would be allocated, what the policies behind them would be. So still to be determined, but I think the major question is whether in the final year-end appropriations bill, the Senate agrees with the House to include that kind of funding in there for that sort of program.
Thank you. I know Parkland is looking at trying to implement that. We have a lot of new graduate RNs who are looking for nurse practitioner jobs, and it's really hard for an inexperienced nurse practitioner to find a job. So we were trying to think of a way to make that happen. So I don't know if anybody on the call here has that in their hospital right now, but has experience about that. That might be something that might be interesting to present in a future conference. There are people who do that.
There is also ongoing effort, and I think so much is unknown about where this next coronavirus package, if there is one, where it might go. But there is certainly an ongoing effort to try to find some emergency or supplemental funding for nursing workforce development programs generally that might contribute to those areas. But I think those discussions at this point are at such a high level and such an undetermined level that it's really hard to figure out whether they're possible or if they are possible, what they might be targeted at. But it's definitely something that we're keeping an eye on.
Thank you. I think priorities shifted pretty rapidly this year. Everything's kind of unexpected, so just keep us posted.
Absolutely.
Thanks. Any other questions for Dave? If you think of any questions after tonight's call, please feel free to email healthpolicy@napnap.org, and I'll make sure that Dave gets your question and we get an answer to you.